God cannot be everywhere, so He sends doctors in our lives.
Thank you, Seema, for this kind words. And as obstetricians, I think every doctor will pray that God is with them for each and every delivery.
There is a trend now that we see girls getting menstrual cycle at age of 10 to 11. So could there be specific reasons, factors which is leading to this change?
Yeah, as you rightly said, the girls usually follow the genetic pattern of their mothers or their aunties, or the family history trend is there. But of late, and especially after COVID, when the online teachings have increased, we are seeing women and girls getting menses as early as 10 years of age. Aim of obstetric care is a healthy mother and a healthy baby at the end of the 9 months. The mode of delivery is not in the hands of doctor. We have patients who come to us in the first 3 months and they say, Doctor, आप normal delivery करोगे क्या? I think only God will know whether that delivery is going to occur normally or not.
When we give birth to a baby, we also give birth to an incredible strength and love that comes with motherhood. This is indeed one of the beautiful stages in woman's life, needing special healthcare. Similar to this stage, women also need special healthcare during their adolescence, midlife, and postmenopausal stages in life. Yes, friends, you have guessed it right. Today, we are going to talk on women's health with an expert in space of gynecology. Please welcome Dr. Samir Pradhan, one of the senior gynecologists doctor in Mulund with almost 30 years of experience. He is considered as one of the best gynecologist, obstetrician and a trusted women's health doctor in Mulund and Vikhroli. Throughout his academic career, Dr. Samir Pradhan has received prestigious awards including the National Talent Scholarship in 1986 and the Lord Sandhurst Gold Medal from Mumbai University in the year 1991, demonstrating his dedication to excellence. He completed his MD from prestigious SET GS Medical College and Navroji Wadia Maternity Hospital in 1997 and then obtained a DNB from the National Board of Examination in New Delhi in 1998. Dr. Samir Pradhan currently serves as the proprietor and director of Samarth Maternity and Nursing Home, Mulund, and a consultant at Godrej Memorial Hospital, Vikhroli, Fortis Hospital, Mulund, and Jupiter, Thane, providing patients with convenient access to his expertise. Dr. Samir Pradhan's core competency is advanced gynecological surgeries by minimal access routes, mainly natural orifice vaginal route or keyhole laparoscopic route without any cut on the abdomen, managing complicated cases of pregnancy with advanced age, especially following IVF conceptions or with recurrent pregnancy losses, managing women troubled by urinary symptoms of incontinence, prolapse, and vaginal cosmetic surgeries. Dr. Samir, what is the typical proportion of patient base between school-going, college-going, mid-age, and senior citizens?
So typically for a generalized gynecologist like me, the school-going girls, means the girls between the age less than 15 years, usually constitute 5 to 10% of the population. Usually they have early onset of menses nowadays, or some problems during menses like heavy menses or irregular menses, or sometimes they don't get menses only till the age of 15 years. The college-going girls, means say 15 to 16 to age of 25, constitute another 10% of the patient base. The senior citizens, that is the age more than 60 years, usually is another 10%. They have problems like something coming out per vaginum, or they have some problems like bleeding after the bleeding has stopped, or they may have urine problems, they pass urine while coughing or something.
Okay.
The majority patient base, that is almost 60 to 70%, is the age group between 25 years to 60 years, which includes the reproductive age group between 25 to 50 years and the age group of 10 years after menopause, that is 50 to 60 years.
Sure. So I think you referred that there is an early onset of menstrual cycle for girls, right? So typically my understanding is it will follow the genetics. They'll follow a cycle which is of their mom, right? But typically, I think there is a trend now that we see girls getting menstrual cycle at age of 10 to 11.
Right,
So
right.
could there be specific reasons, factors, which is leading to this change?
Yeah, as you rightly said, the girls usually follow the genetic pattern of their mothers or their aunties, or the family history trend is there.
Right.
But of late, and especially after COVID, when the online teachings have increased, we are seeing women and girls getting menses as early as 10 years of age.
Okay.
There is no specific reason, but there are certain contributing factors.
Okay.
One of the commonest cause is increased childhood obesity and overweight. That is the body mass index is
Okay.
increased in the children.
Okay.
Typically because of the fast food, cold drinks and all other things. The screen time is increased. We see this generation staying awake in the night,
Right.
which causes reducing the melatonin hormone levels and it
Okay.
causes hormone fluctuations.
Okay.
Those who are prone to more non-vegetarian food, there is increase in a hormone called insulin-like growth factor 1,
Okay.
which predisposes them for early maturity
Okay.
and basically early menses.
Okay.
Lot of vegetarians are using soya-based proteins, and soya isoflavones are there in those soya proteins. This gets converted to phytoestrogens, which are the main feminine hormone and similar to the estrogen, and this causes them early onset of menses.
Okay.
Lot of these packings, tin packings and other packings of the snacks, or even when you order fast food, we get a bill which is paper coated. They have this plastic diphenol derivatives.
Okay.
These are like endocrine disrupting substances.
Okay.
So they leach in the food materials. When the parent takes it, gets enters the baby through the breast milk, or if you are taking fast food snacks or cold drinks, these materials are increasing and this is causing premature onset of menses.
Okay.
However, if the menses is before 8 years, we have to look at precocious puberty. We have to investigate, get a sonography. And if the menses are delayed beyond the age of 15 or at least 3 years after the onset of secondary sexual characters like breast development, then it is called something called primary amenorrhea, and this particular class of girls require urgent treatment. Otherwise, it is not very significant.
Okay. So do you think there is also increasing rate of PCOS and
Yeah.
maybe some challenges in conceiving?
Yeah. So basically, typically, the girls, the college-going girls which meet us is usually brought by their mothers,
Right.
and that is because of irregular menses.
Yeah.
Or if a couple is married and they are planning a pregnancy for more than 1 year, then and they don't become pregnant, we call this inability to conceive.
Right.
So infertility, we don't label them immediately.
Sure.
If they plan for 1 year with planned intercourse and everything and they don't become pregnant,
Right.
then we call them primary infertility.
Okay.
So in these patients, we take the history of the girl or the lady, and if she has irregular menses, we ask them to do a sonography.
Okay.
Most of the sonography reports sometimes now show the ovaries having multiple follicles,
Okay.
and the sonologist reports this as a PCOD, which is the full form is polycystic ovarian disease.
Okay.
But we have to understand there is something called polycystic ovarian syndrome, that is PCOS.
Right.
The PCOS incidence has increased, but all ovaries which are enlarged are not necessarily PCOS.
Right.
To label a patient as PCOS, she should have irregular menses, any two of these three criteria. Basically, irregular menses, there are certain signs of hyperandrogenism, means excess androgen, that is a male hormone in the body,
Okay.
like that could be hirsutism, male pattern hair loss, that could be obesity, androgenic type, that is they have a belly,
Right.
or sometimes they have some blackening at the nape of the neck, it is called acanthosis nigricans.
Okay.
So such patients, and if the ovaries are enlarged in size,
Right.
then they are called PCOS.
Okay.
So for such patients, what we essentially do is we first counsel them. We do certain tests, we check their height and weight, and we calculate the body mass index.
Right.
Obesity and PCOS have a direct correlation.
Sure.
And obesity causes PCOS, and PCOS leads to obesity. It becomes a vicious cycle.
Right.
We do a thyroid hormone test, we do a prolactin test.
Right.
Hypothyroidism and hyperprolactinemia are other main causes. And most of the times the causes we don't know, they just occur.
Okay.
So we explain to the couple about ovulation and how pregnancy normally occurs.
Right.
So essentially all the women have a uterus, which is the womb. They have 2 fallopian tubes on each side, and there are 2 ovaries, which is normal. When the girl becomes a lady and starts getting her menses, a group of follicles in either one of the ovaries start growing.
Right.
That is called the ovarian cycle. The follicle grows. One of the follicles becomes a mature follicle, which is capable of forming a baby.
Right.
And say around the 14th or 15th day in a 20 to 30 day cycle, the egg ruptures and the follicle comes in the fallopian tube.
Right.
The fallopian tube is the natural incubator, and this egg remains alive for 2 to 3 days. At that particular time, if the girl has had intimate contact, the husband's or the partner's spermatozoa travel all the way, and then a pregnancy occurs, and then a embryo which is formed later comes to the uterus. Once this egg is released, whatever remains is called the yellow body or corpus luteum. Now all this ovarian cycle changes causes changes in the lining of the womb. So after menses the lining is shed.
Right.
When the follicle grows, the estrogen, that is the natural feminine hormone, grows. The lining keeps on growing.
Right.
And once the corpus luteum is formed, it also secretes progesterone, which stabilizes the endometrial lining.
Right.
Why this is required is when the embryo comes to the womb, it should get nourishment and blood supply.
Right.
So it gets glycogen and blood supply from this grown endometrium, which is called a secretory endometrium.
Right.
Now suppose the pregnancy does not occur. If the pregnancy does not occur or there is no sexual contact, so the pregnancy will not occur.
Right.
This particular corpus luteum after 14 days just dies. It just shrivels up and becomes atrophic.
Right.
The progesterone and estrogen hormones drop and the entire lining is shed.
Right.
So for the girls who are having menses, we have to explain to them why this occurs.
Right.
And then for the married couple, we have to explain to them how the process of pregnancy occurs and how we approach the treatment.
Right.
Now for the girls, what we essentially tell them is when the ovulation is not occurring, the second half of the cycle is not occurring, and hence they are not getting periods for a long time. And when they get the periods, they are heavy periods.
Right.
So as a gynecologist, first we allay their anxiety because the mother is also very anxious. The girl is very scared what is happening.
Right.
She compares with her peers in the college.
Right.
And then we counsel them, tell them that we'll treat the heavy menses part first. We investigate. If there is any specific problem, we address it. We advise them about healthy lifestyle, exercises, healthy diet, at least 10% weight reduction. We cannot give them a very large target and it demotivates them.
Sure.
If there is any problem in the thyroid or prolactin, we correct that part.
Right.
And we tell them that we have to give them an oral contraceptive pill. Nowadays, good pills are available which don't cause increased weight gain.
Yeah.
If the the girl is having some hirsute features, we give them an oral pills containing anti-androgens which reduces their hirsutism.
Sure.
Some of these girls we refer to a dermatologist who gives them treatment so that they don't have a reduced body self-image because of hirsutism or obesity.
Right.
And we essentially tell them that they should get menses at least 3 times or 4 times in a year. And this treatment may be prolonged till they get married and till they want a baby.
Right.
The basic treatment for PCOS is giving medicines which will cause ovulation.
Sure.
But we can give this treatment only for a woman for a life of only 1 year. Else it can cause major problems later on in life like cancer ovary.
Okay.
So we reserve this ovulation inducing agents only to married women or women who are desiring pregnancy.
Sure.
For the girls, we treat them with the healthy lifestyle advice and oral contraceptive pills.
Okay. Okay. So, typically, what are the 3 top complaints or requirements for which any patient actually consult gynac?
So, as I said, different age groups, the majority always is the menstrual complaints in whichever age group.
Sure.
Then in the reproductive age group, as you had pointed out, 50% are pregnant women,
Right.
and 50% or almost 40% want to have pregnancy. So the infertility is rising.
Sure.
And the remaining are gynec problems, like the problems of any lump in abdomen or anything coming out per vaginum. So that are the different complaints.
Okay. So, as obstetrics is the topmost requirement for which you are consulted,
Yeah.
do you want to throw more light on that area?
Yeah, so basically, as a practicing female specialist, we have a degree called Obstetrics and Gynecology. Obstetrics deal with midwifery, that is a care of a pregnant woman.
Right.
And gynecology deals with everything except pregnancy.
Right.
Now, motherhood is a dream for every woman.
Sure.
And unfortunately, the woman feels that she is incomplete if she does not become a mother.
Yeah.
So that is why obstetric care is very important. And this obstetric care, we tell the woman to meet us as soon as she becomes pregnant.
Right.
There are certain problems which are in the rise nowadays.
Okay.
That ectopic pregnancy can be there. That is the pregnancy, as I said, it conceives in the fallopian tube. It remains in the fallopian tube due to certain reasons,
Okay.
and then that fallopian tube cannot grow and it ruptures. That can become a medical emergency.
Okay.
If they see a doctor early, we can treat it medically and save the tube.
Okay.
So the part of obstetrics which deals with a pregnant woman is antenatal care.
Okay.
What deals with the process of delivery and labor is the internatal care.
Okay.
And what is after delivery comes the postnatal care.
Okay.
So we had to give a comprehensive care throughout the pregnancy.
Okay. In the podcast episode of dentistry, I think I had shared my personal experience
Okay.
of tooth pain. I think the BP fluctuations taken and the delivery complications which took place later. So I can proudly say that in spite of the delivery complication, the cesarean delivery was in magical hands of Dr. Samir Pradhan. So as well said, God cannot be everywhere. So he sends doctors in our lives. We are blessed to have Dr. Samir in our lives. So Lalit, Atharu and myself are really blessed. So Dr. Samir, do you want to share with our viewers what is the impact typically BP fluctuations could have on the patients and how to deal with that?
Yeah, thank you, Seema, for these kind words. As obstetricians, I think every doctor will pray that God is with them for each and every delivery. Because delivery is actually a physiological process. The whole aim of antenatal care is to have a healthy mother and a healthy baby at the end of pregnancy. And we are dealing with two lives.
Sure.
But there are certain problems which can occur anytime. So the aim, as I was saying, of obstetric care, the antenatal care, is to maintain the physiology of pregnancy, and that is why we advise them frequent visits.
Right.
We tell them to come every month in the first 7 months, then every 15 days in the next 2 months, and in the last month we tell them to come every week.
Right.
Each time when they come, we check their blood pressure.
Okay.
There are two different reasons of high blood pressure in pregnancy. Sometimes now with the advent of IVF and more elderly people becoming pregnant, they are already having essential hypertension.
Okay.
And they are on tablets, and the commonest tablets which are used are the ARB blockers like telmisartan.
Okay.
So if the patient is already taking these tablets and she's planning a pregnancy, this tablet has to be changed by the treating physician or the cardiologist.
Okay. Okay.
Because ARB blockers and angiotensin inhibitors are contraindicated in pregnancy, they harm the baby.
Okay.
So we shift to something called a labetalol, which is a alpha and beta blocker,
Okay.
or a calcium channel blocker like nifedipine.
Okay.
Now there is certain patients develop de novo hypertension, that is they develop blood pressure after the first 5 months of pregnancy, which is called gestational hypertension.
Okay.
And this gestational hypertension cases can have different complications in pregnancy, so they require special tests. We monitor the liver function tests, the uric acid levels.
Okay.
and they also impact the growth of the baby. So we monitor the baby also.
Okay.
So that we call preeclampsia sometimes. Now your case was a one-off case. Means in throughout your whole 9 months when you were showing me, your BP never had gone up.
Right.
Probably that toothache which you mentioned in your previous podcast was just a triggering factor.
Right.
When you came in labor also the blood pressure was normal and suddenly it shot up.
Okay.
So this sudden rise of blood pressure is a big obstetric emergency for us.
Okay.
What it essentially does is during pregnancy there is this baby and the uterus, the baby in the womb, and there is this placenta.
Right.
When this blood pressure rises suddenly, then this placenta can separate prematurely.
Right. Right.
We call it in our medical terms abruption of placenta,
Okay.
and there can be heavy bleeding, which we call antepartum hemorrhage.
Okay.
And this warrants a immediate delivery. Like we have to deliver as soon as possible.
Okay.
If the patient is advanced in labor, we can deliver by instrumental delivery like vacuum or forceps,
Okay.
or we have to take her for a cesarean section.
Okay.
And we have to be prepared that after delivery also there can be excess bleeding, which is called postpartum hemorrhage.
Okay.
The uterus may not contract, and if there is excess blood loss, the patient may have a consumptive coagulopathy where the bleeding is unstoppable.
Okay.
So we have to be prepared in pregnancy trolley where we have all the kits which are there at our disposal.
Sure.
If the pregnancy is, the BP keeps on increasing throughout the pregnancy, and there is preeclampsia, very rarely prone for a convulsion, which is called eclampsia.
Sure.
So that eclampsia also has to be managed by a medicine called magnesium sulfate. So we have a kit where we have magnesium sulfate.
Okay.
So these two are the commonest nightmares of every obstetrician: obstetric hemorrhage and eclampsia.
Okay.
That is why it is essential that every woman delivers in a nursing home. In the olden times, there used to be home deliveries. Even in the village, there is this concern that at home delivery, the delivery can be better by dais who are trained.
Right.
But now government has made primary healthcare facilities available. There are district hospitals. Government is putting a lot of efforts in the mother and child welfare. So I think all women in India should visit a primary healthcare center or an obstetrician throughout labor. And the labor has to be monitored, because sometimes inadvertent problems like sudden high BP, as in your case, can occur unexpectedly.
Right.
And as we were taught in our school days in Scout and Guides, the motto of a Scout and Guide is be prepared.
Right.
For an obstetrician, our motto always is be prepared for these two major complications.
Sure.
So that is ensured in an institutional delivery in a hospital.
Okay.
That is the importance.
Right. I think I also recollect that during my pregnancy, you had recommended few tests to be done,
Yeah.
which will help early detection of Down syndrome with a baby, if any.
Yeah.
Yeah. So do you want to share something with
Yeah.
viewers?
The tests which a doctor advises in the antenatal care are very important.
Right.
So in the first visit, we typically advise a woman complete blood count, a urine routine so that to rule out any infection. We see her sugars. We see her thyroid status. She should not be hypothyroid or hyperthyroid. That we come to know by the TSH levels.
Okay.
There should not be any infection like HIV, HBsAg, HCV or VDRL, that is syphilis.
Okay.
So these are the basic tests which we do.
Okay.
Nowadays, with the advance in the imaging techniques, we advise them sonography.
Right.
Early sonography as early as 1.5 months detects the gestational age of the baby by a crown rump length.
Okay.
And in the woman, like you said, in PCOS, the cycles are irregular. Our dating becomes difficult.
Right.
So this sonography, the first sonography, gives accurate dating. Then you mentioned about Down syndrome. Down syndrome is essentially trisomy 21.
Okay.
So there are 3 pairs of chromosome 21. Otherwise, we all have 2 pairs of all chromosomes.
Okay.
Now, these babies can be very severe Downs, or there can be a mosaicism, and some of the chromosomes are having Downs.
Okay.
There are certain tests like a dual marker test and a sonography at around 11 to 12 weeks called a genetic scan, where we see the thickness of the nape of the neck and we see whether the bridge of the nose is forming.
Okay.
There are other soft tissue markers. So this helps us to predict whether this baby is normal.
Okay.
And if it is normal, we can reassure the woman that the baby is normal. We can do a dual marker test at between 11 to 13 weeks.
Okay.
That is, there's a quadruple test at 4 months, around 16 weeks. This test are screening tests.
Okay.
Means they will help to tell the obstetrician that this patient is a high risk of a Down's baby or a baby with a genetic abnormality. And then it is not confirmatory. So we can screen those women who may require a confirmatory test by we do something called amniocentesis. By sonography guidance, we put a needle in the abdomen under sterile aseptic precautions. We remove some fluid and we test it for the genetic makeup called karyotyping, and nowadays it is called microarray, which can give us genetic defects.
Okay.
Then also we do an anomaly scan at around 18 to 20 weeks, a cardiac 2D echo scan if required in an elderly age group or diabetic mothers around 24 weeks, a growth scan at around 30 weeks, that is 7.5 months, and a Doppler test at full term. Why all these tests are required is that we have to ensure the healthy baby. Why that Down syndrome test is very much important is, suppose the baby has a genetic defect, then in our country the MTP rules are very lenient, and nowadays we can do medical terminations legally under government approval in a government approved center up to the gestational age of 24 weeks, that is almost 5.5 months.
Okay.
So the couple can decide whether they want to continue an abnormal baby. The sonography helps to diagnose the anatomical abnormalities, like suppose some of the babies are having half skull, sometimes they have a defect in the spinal cord, sometimes there is the whole stomach is outside. So these defects can occur.
Okay.
We normally suggest in our pregnancy counseling that we have folic acid supplements which will prevent these defects.
Right.
But if they are there, the woman does not have to live with it throughout the pregnancy and afterwards after delivery.
Sure.
So that option of termination is there. That is why these tests are important.
Thanks. So, Dr. Samir, when is the normal delivery suggested and when is a cesarean section suggested by a gynec?
So very nice question. Normal delivery. I think nowadays the whole community is looking at obstetricians, and they are now feeling that obstetricians are doing more and more cesarean sections.
Right.
We get reports in the papers about WHO, the World Health Organization, trying to curb the incidence of cesarean sections. So as I said earlier, that the aim of obstetric care is a healthy mother and a healthy baby at the end of the 9 months.
Right.
The mode of delivery is not in the hands of doctor.
Right.
We have patients who come to us in the first 3 months and they say, "Doctor, aap normal delivery karoge kya?" I think only God will know whether that delivery is going to occur normally or not, because pregnancy itself is a dynamic process.
Right.
And labor is still dynamic.
Sure.
As obstetricians nowadays, we have stopped using the term normal delivery. What normal delivery essentially means that the delivery occurs in the vaginal route.
Right.
Now, to have a delivery in the vaginal route, there are a lot of preconditions required. The baby has to be healthy. There should be adequate liquor. The position should be conducive. The maternal canal should be roomy. And the whole process of labor should be uneventful without any problem to the mother and the baby. And then what we deliver vaginally is called a vaginal delivery.
Sure.
Sometimes the woman can have problem in the last stage, that is the second stage, to bear down,
Right.
wherein we can aid the delivery with an instrument like a forceps or a vacuum,
Sure.
which we call an instrument vaginal delivery.
Right.
And suppose these conditions are not met, then we resort to something called cesarean section,
Okay.
where we resort to opening the layers of abdomen and delivering the baby from the abdominal route.
Right.
The misconception is that doctors are doing cesarean sections for the sake of money.
Right.
That should not be the case, and because of that misconception, nowadays at many places the rates are almost comparable with a normal delivery, which is called a vaginal delivery, a instrumental delivery, or a cesarean section.
Okay.
That particular bias or the apprehension of the patient is taken care of.
Okay.
Now, why these cesarean section rates are increasing, that the audience should know.
Sure.
Our anatomical teacher used to tell us when he used to teach us anatomy, that is our first MBBS class,
Right.
that the cesarean section is a curse to humans because of the erect posture.
Okay.
Have you ever heard any elephant undergoing cesarean section, or a giraffe or a zebra?
Right.
None of the animal kingdom there is cesarean section because they walk on 4 legs.
Sure.
We are the only species of mammals who walk on 2 legs,
Right.
and our upper extremities have become hands, which are more functional. Also, we are the intelligent species, so our brain size is bigger. As the development has occurred in the last 3 decades since I am there, in 1994 I started my OBGYN training at KEM and Wadia, which is one of the prestigious institutions.
Right.
And now in 2024, we are finishing 2024, almost 30 years.
Sure.
Each decade I have seen the cesarean section rates increasing.
Okay.
This is because the activity of the woman is reducing. Earlier times they used to squat, do all the exercises, they used to do household work,
Right.
by sweating and then cleaning the
Floor.
floors, or they used to make buttermilk with holding the utensil between the 2 legs and then doing it.
Right.
These are our now exercises which we teach them, and we have to start doing it from the second month of pregnancy,
Sure.
so that those muscles are accustomed.
Right.
Breathing techniques have to be improved. Then the generations are more active.
Right.
So what happens is when they are moving constantly inside the womb, the cord gets entangled around the neck, and then they have a typical deflex position during delivery, or the cord becomes tight and the heartbeats drop.
Okay.
Other things are more and more elderly patients are becoming pregnant, so they have comorbid conditions like hypertension, diabetes, any heart problems. Because of IVF, there can be twin pregnancies. So one baby is head up, other baby can be opposite side breech. They can get mixed, entangled between each other. It's called locking of the breech. The position of the babies can be transverse lie or breech. So we can for sure tell in the last sonography that these patients are going to require cesarean section. That means the baby is breech or transverse, or the placenta is low lying, or there is a medical condition, or there is a previous cesarean section or previous myomectomy scar on the uterus. The uterus may just rupture during pregnancy. As in the twins, if the first twin is breech. So those conditions we tell them that you are going to require cesarean section for sure. Anything else, if all these factors are ruled out, as a healthy baby, we can always try a vaginal delivery, and that should be the preferred route.
Right.
The new generation is having apprehension of the pain, and they are going to be able to bear the pain or not. We all know the 3 Idiots vacuum scene, and the baby was not crying immediately after birth, and the mother was exhausted.
Right.
So that it is a good scene, very nicely, very well depicted. So nowadays we get, वो pain नहीं मांगता है, 3 Idiots जैसा, और baby तुरंत रोना मांगता है. The woman itself asks for cesarean sections.
Right.
But we have something called epidural analgesia. And the active pain labels, the active labor starts, the pains are more severe. We give called the anesthetist, and they give a injection in the spine, in the epidural space, where we put a catheter.
Okay.
And we can give top-up doses that time. So the pains will continue, but the woman in labor will not experience the pain.
Okay.
The advantage additionally is the labor progresses fast,
Right.
and it is painless.
Sure.
Only disadvantage is sometimes the bearing down sensation which is required for the last stage, just to push the baby out, which was shown in that movie also,
Right.
is difficult,
Okay.
because the woman's those motor systems also slightly sometimes compromised.
Sure.
So we may require additional help of vacuum, which was shown in that movie,
Right.
or forceps.
Right.
Now, if it's not applied properly, the baby can have certain problems, and or the mother can have genital tract trauma.
Sure.
That has caused fear, and with the past experience, sometimes a lady tells us to avoid vacuum forceps completely. But one should not be dogmatic about that, because sometimes during a cesarean section also we apply vacuum forceps. These are time-tested instruments to aid the obstetrician in a healthy delivery of the baby.
Sure.
In fact, if I have to do a cesarean section for a preterm breech, I use something called a cage forceps. Means the preterm baby's head is very narrow and there is a high chance of an intraventricular bleed. So during a cesarean section, I apply forceps voluntarily so that the baby's head is protected gently and it comes out gently with the forceps
Okay.
during a cesarean section. And this is a very acceptable technique.
Okay. Okay.
Yeah.
Thanks. That was very informative, Dr. Samir. So, do you want to share with the viewers on what is the normal process followed for a vaginal delivery?
Yeah, so if a patient we are trying for a vaginal delivery, we tell them in the last month, as I said about a Doppler scan, we do a Doppler scan at around 36-37 weeks. The actual gestational period is 40 weeks. Therein we confirm that the baby has grown well, the placenta is well up,
Right.
the amount of fluid which is surrounding the baby is enough. That acts as a, we can say, a shock absorber when the contractions occur. We tell them to keep a fetal daily kick count, that is called maternal perception of fetal movements, so that it is an analogy of a sick baby and an active baby. Suppose you have a toddler.
Okay.
If it is healthy, it will keep on moving. It will not stay at one place. But if the toddler is having fever for whatever reasons, it will be just lying at a place.
Right.
The same thing happens in the uterus, in the womb, in the last month.
Okay.
So the baby is active and moves well, it is the baby is healthy.
Right.
Whenever the mother says that the baby is not moving, we give a lot of importance. Then we monitor the heartbeats over a 20-minute strip. That is called a non-stress test.
Okay.
There is no stress of labor that time. Patient is pregnant. 9 months are completed. We just want to ensure that the mouth of the womb, that is the cervix, which I had shown earlier, ripens so that the normal delivery, which nowadays we call vaginal delivery process, is smoothened.
Right.
So that NST should be done either once a week or at least twice a week. We tell the patient, if you get labor pains, it will start from the back and go towards the thighs. Or you get leaking, they will just pass something like a urine automatically. Or any slight bleeding or backache
Okay.
or the fetal movements are reduced, come to the hospital immediately.
Right.
Or if there are certain conditions like the woman is going post-dated, that means her date is going beyond the date of delivery,
Right.
then we do something called induction of labor, where we artificially start the process of labor
Okay.
by putting a cream in the cervix and ripen the cervix.
Okay.
Then we can give tablets or medicines through the IV line. So that time we keep the patient not on solid foods, only they should have clear liquids.
Okay.
Because I said labor is a dynamic process. We monitor the vital parameters. As in your case, we diagnose a high BP.
Right.
The BP from 120/80 suddenly shot up to something like I remember 190/130 in span of 2 hours.
Right.
So that was very alarming.
Sure.
So that we have to monitor.
Okay.
We monitor the fetal heartbeats after every contraction.
Right.
Sometimes we have a continuous fetal monitoring.
Okay.
Whenever the patient comes in labor, we put an IV line. We keep a blood reserved for grouping and cross matching.
Okay.
So that is a important criteria, and we keep a IV line going. It
Okay.
hydrates. In the first few hours, we can ask the patient to be ambulatory. A partner can be with her. A mother can be with her.
Okay.
She can listen to good positive songs, learn breathing techniques. And then during delivery, we have a proper delivery tray ready, which all vacuum forceps. Pediatrician is always there. I have an extra habit of calling anesthesiologist also. So I have an extra helping hand in case something is required.
Sure.
And then we tell them to empty the bladder. We give an enema so that the bowel is empty.
Okay.
It does not soil the delivery area, because those passages are very close to each other. And also, an empty bowel and empty bladder hastens the process of labor. The baby can descend better.
Right.
Then we always give for the first pregnancy something called an episiotomy, that is a cut on the perineum.
Okay.
That is to prevent an injury to the rectum.
Okay.
Because if the during delivery there is a trauma called perineal trauma and it is a 4th degree, it goes in the rectum, then some of the woman, if it is not repaired properly, which is called an obstetric anal sphincter injury, then they can have incontinence of feces and flatus lifelong, which is a very traumatic condition. That is why we give the episiotomy.
Okay.
Then we deliver the baby with the proper support,
Okay.
and then the baby is immediately handed to the pediatrician.
Okay.
So this is all the intranatal care. The care does not end over here. The next 2 hours after delivery is the most crucial period.
Okay.
Here there is a chance of postpartum hemorrhage. So after the baby is born, normally everybody goes with the baby, as we were students also.
Right.
But the doctor used to be with the patient. We have to deliver the placenta. It is called the afterbirth, and it has to come out completely.
Okay.
And the commonest cause of postpartum hemorrhage is some retained bits of placenta.
Okay.
And then we ensure that the uterus, which had become a big size, become like a cricket ball and hard. So we have to give uterus contracting agents that time.
Okay.
And that is PPH is the commonest cause. And then we have other things to manage that if there is a problem.
Right.
Subsequently, for next 3 to 4 days, we keep the patient in the hospital and we give them perineal care for the episiotomy. So they don't soil it. We teach them how to take care of the care.
Okay.
I give them a booklet made by the 15 pediatricians way back in 30 years back.
Okay.
It explains all the things required for a mother to know about the breastfeeding, the baby's nutrition, the weaning, and the immunization in the first year of life.
Okay.
Because in our country, there are a lot of misconceptions. We give a lot of supplements, bal kadu, pregnancy kada, all this, top feeds.
Right.
Exclusive breastfeeding for first 6 months is the best way.
Right.
And we have to teach them how to breastfeed.
Okay.
We have to tell them the anatomy of nipple, areola. Because if it is not done properly, there is increased chance of breast abscess.
Okay.
And that breast abscess is a very traumatic condition after delivery.
Sure.
And then we also tell them about the baby's problems which are normally going to occur, like a transitional stools or a jaundice on the 3rd or 4th day. So all this comprehensively includes a care of what you call a full-term normal delivery or a vaginal delivery
Right.
or any delivery for that matter.
Right. So on similar lines, do you want to explain the process for cesarean delivery?
So cesarean section slightly differs.
Okay.
If it's a planned cesarean section, then we have to have a sterile operation theatre. Of course, the labor room also, which we do for normal delivery, is sterile.
Sure.
Even the instrumental deliveries we do in an operation theatre.
Okay.
We call the anesthetist. The patient is fasting. We give them enema. IV line is given, started. We give 1 or 2 IV fluids to preload the patient.
Right.
And we give a regional anesthesia. We just give a spinal anesthesia so that the part below the umbilicus is paralyzed for that 1 or 2 hours.
Right.
So it does not impact the baby. Any general anesthesia can cause the gases can go to the baby and the baby can have mild respiratory depression.
Okay.
So general anesthesia is given for very few cases.
Sure.
Then we usually have a core surgeon with us because 2 heads are better than 1
Right.
if there is a problem.
Sure.
And then we nowadays take a transverse incision called a bikini incision. Earlier they used to take a vertical incision, but nowadays I think almost since 3 decades, since I learned, we have completely shifted to transverse incision.
Okay.
It is not the cosmesis as much as the better healing, less pain,
Right.
and it is a grid iron incision. That means some layers are cut horizontally and some are cut vertically.
Okay.
So there is very less risk of hernia, which is the commonest problem of any laparotomy. That means any cut on the abdomen.
Okay.
So that is the thing. And rest we have a pediatrician,
Okay.
and the rest of the care is almost same like that of a normal delivery,
Okay.
of a vaginal delivery.
Is there a special care which will be required for a patient with possibly diabetes?
Yeah, so with this advent of IVF and women trying to delay that pregnancy till they settle, career, so the education only goes on till the age of 32, 35, then they want to settle. Diabetes is increased.
Right.
Again, like in hypertension, there can be essential diabetes. I have right now a patient who is juvenile diabetic,
Okay.
means and she's on insulin.
Okay.
They may be having a type 2 diabetes which develops later on in life after age of 30, 35.
Okay.
And there can be something called gestational diabetes.
Okay.
Because insulin is the hormone in the body which is going to reduce our sugars and help control diabetes. But the pregnancy hormones like progesterone, estrogen are steroid hormones.
Okay.
And all that increases the sugar levels.
Okay.
So whenever the patient comes in our first visit, we do a test called a fasting sugar.
Okay.
If the patient is already a diabetic, we do something called a HbA1c, called glycosylated hemoglobin.
Right.
If the patient diabetic is planning a pregnancy, that HbA1c should be controlled. If the HbA1c is very high and the patient becomes pregnant, there is a very high chance that the baby will have congenital anomalies and heart anomalies.
Okay.
And then they will require termination. So the sugars have to be controlled before pregnancy and on insulin.
Okay.
The oral medicines which are taken to control diabetes, only the metformin is right now approved.
Okay.
Otherwise, other medicines are not approved because they will cross to the baby and they cause hypoglycemia in the baby.
Okay.
Then we do certain tests called DIPSI. Means we give them a 75 gram glucon-D load and then check the sugars after 2 hours.
Okay.
And in that 2 hours time, they should not have anything. If it is more than 140 milligram %, it is gestational diabetes.
Okay.
If it is 120 to 140, it is glucose intolerance.
Okay.
And 100 to 120 is considered normal.
Okay.
So such a woman, we tell them a diabetic diet, means to reduce the sugars, and avoid sweets, avoid cold drinks.
Okay.
Fresh fruit juices may be allowed.
Right.
Certain fruits have to be avoided, like mango, all the tasty foods, jackfruit, sitafal, custard apple, they have to be avoided.
Okay.
And in the vegetables, green leafy vegetables have to be taken.
Okay.
We can add metformin. And if the sugars are still not getting control, we take the help of a diabetologist
Okay.
who gives them different insulins. Nowadays, insulin analogs are available, and that they have to take throughout the pregnancy.
Okay.
Monitoring is more strict. These patients tend to have more bigger size babies.
Okay.
The babies pass more urine, so the liquor is more, so it's called polyhydramnios. Then the placenta size is more. Sometimes the placenta becomes previa.
Okay.
There can be associated hypertension of pregnancy. And if the baby is very big in size, like more than 4 kilos, then there can be something called shoulder dystocia. It's a very dangerous complication that I'm planning a normal delivery. Generally, what happens in a normal delivery is after the head is born, head is the biggest, we can say a ball, and the womb is, the mother is like a ring. And when the big ball goes to the ring, the whole thing just slips out.
Right.
But in diabetics, I think there is shoulders can get obstructed.
Oh.
And then it becomes a very difficult situation. We have certain drills to take care of this,
Okay.
but it is best avoided because then that can cause dislocation of the baby's shoulder joints, fractures, and birth trauma.
Okay.
So we then prefer to do a cesarean section in such babies.
Okay.
Then the babies also require special care because the mother should breastfeed well because the baby is used to that higher level of sugars. So then their pancreas is manufacturing more insulin. And then after delivery, if they don't get that much sugars, which is not possible in breast milk, the sugars drop and they get hypoglycemia.
Okay.
And that can cause convulsion because brain gets the only energy from glucose.
Sure.
And that convulsion can cause generalized brain damage and make the baby weak throughout life. Also later on the third day, as I mentioned, that something called physiological jaundice comes. These diabetic mothers are more prone to that jaundice.
Okay.
So we counsel the woman that the babies are going to require NICU care.
Okay.
Like just last year I delivered a twin pregnancy, 50-year-old, having hypertension, diabetes, a liver problem, full swelling of the body, twins. So one baby was breech, that means upside down, other was transverse,
Okay.
and severe diabetes on insulin.
Okay.
And luckily everything went on well by God's grace. As I said, God, I take him during all deliveries.
Sure.
And both the babies were good. And then she came and met me after 3 months and showed me photos of the daughters.
While we have covered the area of obstetrician largely, I think we should also touch base upon the issues like cyst, fibroid faced by women, which possibly lead to hysterectomy in few cases. So do you want to share more information?
Yeah, so as I said initially that there are two broad our parts of any female doctor, like what they call ladies doctor is obstetrician and gynecologist. The gynecology part deals with a non-pregnant woman. We have already touched upon the irregular menses part.
Right.
The commonest reasons which a lady will seek a doctor for gynec complaints is heavy bleeding,
Right.
which is called menorrhagia. There can be pain during the bleeding, which is called dysmenorrhea.
Okay.
There can be frequent menses, means they will get period 2 times in a month,
Right.
called polymenorrhea.
Okay.
There can be, sometimes they can feel a lump in the abdomen.
Okay.
So when this usually happens typically at the age of 35 onwards, very rarely in a younger age group also. So then when they come to us, we take the history in detail.
Okay.
We do something called a gynec examination, where we do a pulse speculum examination. We see the mouth of the womb, that is called the cervix. A good practice is any sexually active woman above age of 30 or 35 should undergo something called a pap smear or a cytology.
Right.
That is to rule out any future problems of cancer in the cervix.
Right.
We used to do it for all patients in KEM when we underwent our training.
Okay.
Nowadays it is called liquid-based cytology, where a new technique is there and we can find a HPV virus. But the awareness should be there and they should ask for it.
Right.
Nowadays in the corporates where I'm attached, there are health programs wherein the pap smear and a gynec consultation is must,
Okay.
where we counsel them about all these things.
Okay.
That is called, this we see on the pulse speculum examination.
Okay.
We do a bimanual examination where we come to know the uterus size. If there is any pathology we suspect, then we advise them a sonography.
Okay.
Mostly people are having something called a fibroid.
Right.
That are these are the growths in the uterus.
Right.
Fibroids are benign tumors. The uterus muscle has muscle and fibrous tissue. When it arranges in a separate manner and it causes a localized mass, it is called fibroids or leiomyomas. They are
Okay.
soft tissue tumors.
Okay.
Usually benign, very rarely they can become cancerous.
Okay.
There is another problem where patients having severe pain and heavy bleeding. It is called adenomyosis or adenomyoma.
Okay.
This black dots which you can see, that means the endometrium has gone, breached the barrier and gone in the muscle.
Okay.
Now the endometrium lining normally sheds, as I told earlier when I explained menstruation, and
Right.
this comes out.
Right.
Some of this goes through the tubes in the ovaries. You can see it in the ovary also, it deposits.
Yeah.
Now this is also under the influence of the same hormones and
Okay.
they also bleed each cycle.
Okay.
And that blood accumulates there. And slowly this uterus becomes big in size. They can have a localized tumor called adenomyoma.
Okay.
Or they can have blood collection in the ovaries.
Okay.
The blood contains hemoglobin, which has a pigment. And later on, if it degenerates, it causes hemosiderin, which is like a chocolate color. It's old blood.
Okay.
So that causes chocolate cysts in the ovaries.
Okay.
So this adenomyosis, chocolate cysts are part of a bigger disease called endometriosis, which is somehow increasing in this generation because of the early onset of menses. And retrograde menstruation is one of the theories. And it is causing infertility and pelvic pain.
Okay.
Then there are other types of cysts. Sometimes as this corpus luteum, if it ruptures over a blood vessel, it can have a hemorrhage, like how we bang our head and we get a bruise. We don't have to treat that, don't have to do a surgery for that.
Right.
On its own, it goes after a few days. So sometimes that can be a corpus luteal hematoma.
Okay.
But the ovary is supposed to be very small in size. If it increases in weight, sometimes it undergoes torsion or a
Okay.
twist.
Okay.
That is one of the complaints.
Sure.
The ovary itself can have tumors. They can be functional cysts or there can be tumors in the ovary. They are called cyst adenomas, or if they are malignant, they are called cyst adenocarcinomas.
Okay.
Very rarely one can find a dermoid cyst in an ovary. Means that dermoid cyst looks very scary because that particular cyst in the ovary has hair, tooth, some particles of cartilage.
Okay.
That is because ovary is a organ which is causing development of new follicles.
Right.
So it has elements of all the three layers of our body: ectoderm, endoderm, and mesoderm. So that germ cell tumors like dermoid cysts have to be removed. Surgery is very simple.
Right.
For all these patients who come with menstrual complaints and we diagnose, suppose there is no other pathology, we treat them with medical therapy.
Okay.
We give them certain medicines which reduce the amount of blood flow. We can give oral contraceptive pills to regularize the periods. If there is heavy bleeding, then I suggest my patient that they at least do a DNC. Here we dilate the cervix and curate the lining and send it for examination.
Okay.
Rule out something called hyperplasia.
Okay.
Means this endometrium has overgrown. Why it is important? If it is simple hyperplasia, we can give medicines and reverse it. But if it becomes complex, that means the cells become more branched. 25% of them can have cancer in later stage in life.
Okay.
Or if it is atypical, it is already early cancer. So God has given these signals that pap smear one can do, or they have white discharge called leukorrhea.
Right.
For that they approach. We can see some erosion. We can take a biopsy. Our generation, when we started learning something called hysteroscopy. Means there is a scope which we can see inside the cavity of the uterus. This scope is having a light source and a camera, and on a TV screen we can see what is there inside the uterus.
Okay.
So we come to know something like polyps is a growth which can come inside. We can come to know whether the hyperplasia is a different type.
Right.
We can remove that polyp and send it for biopsy.
Okay.
And we can diagnose these major problems earlier in life. So if the lady is less than 40 years and if there is no major problem, for the menstrual complaint, we can nowadays put something called a levonorgestrel containing intrauterine device. It secretes the hormones daily, progesterone hormone, and it prevents her excess bleeding, pain during bleeding, or heavy bleeding.
Okay.
So this is a conservative management. But if it is not getting relieved, the final treatment is removal of the womb, which we call a hysterectomy.
Okay.
If there is a fibroid, we remove the fibroid, which is called myomectomy. It is reserved for those women who want to have pregnancy in future.
Okay.
If ovarian cyst has to be removed, we remove only the ovarian cyst in a younger age group girls. In a very elderly patient with ovarian cyst, we remove the entire ovary, which is called oophorectomy.
Okay.
Now, all these surgeries are traditionally done by a open route where we cut like we used to cut for cesarean sections. But since past 3 decades or more, we are approaching all these surgeries by a keyhole surgery route called the laparoscopy route.
Okay.
The advantage is there are only 3 to 4 holes in the abdomen, which are only skin incisions. And from a keyhole, with the help of a laparoscope, which is a layperson's wrongly called laser, we can do all these surgeries.
Okay.
The recovery is much faster, and there is no other risk of complications of a laparotomy, like wound infection, prolonged hospital stay, or more pain.
Okay.
In addition, our Indian surgeons, we use the natural orifice route, that is the vaginal route.
Okay.
How it is, the analogy what we can give is how dentist, if they have to do something in the tooth, they do through the oral cavity, the natural route which God has given.
Right.
A surgeon, if patient is having hemorrhoids, approaches to the rectal route.
Okay.
So for gynec problems and the removal of womb, we can approach to the vaginal route where so-called normal delivery occurs or vaginal delivery occurs. Right. It requires a special skill set and training, and luckily our generation has been taught that by our teachers.
Okay.
So that vaginal route is the least invasive route. All over the world, the studies are recorded in something called a Cochrane base, and they have compared and they have found that if a womb can be removed by the vaginal route, that is the best route.
Okay.
Only if it cannot be removed by that route, then one can use the help of keyhole surgery, that is laparoscopy surgery. And in few cases, we have to resort to the abdominal surgery, that is the abdominal hysterectomy. So one need not be dogmatic about the route of surgery, but this should be the approach.
Okay.
And as a gynecologist, one should be able to offer all these 3, like a cafeteria approach or a menu card. Tell the patient the advantage and disadvantage and let them decide.
Right.
So that is the way how we approach gynec problems.
Okay. Okay. Can we share some information on menopause, which is experienced by the mid-age woman?
Yeah. So menopause is a whole big chapter. We had a book written by one of our teachers, Dr. Usha Krishna, on menopause. The ovaries, as I said, have the function of producing the eggs and secrete the estrogen hormones.
Okay.
But the follicles are limited, and by the age of 48 or 50, they deplete.
Okay.
And the estrogen hormone depletes, which is the main feminine hormone. So when the estrogen hormone depletes, the menses ceases to occur, and if the woman does not get menses after 1 year, It is called menopause. Why it is important? Estrogen is the prime mover of the woman. It is present in all different parts of the body, in the skin, in the vagina, and also in the bones.
Okay.
So a stage of estrogen depletion can cause symptoms. Mainly the woman can feel very hot. It is called hot flushes. They can have sweating.
Right.
They can have wrinkling of skin, hair loss.
Right.
They can have vaginal dryness, itching in the vagina. They can have symptoms of passing urine while coughing. If the vaginal support system is reduced, the whole organs, if they have had a normal delivery, the organs can come out. It is called prolapse uterus.
Okay.
So they can have difficulty in having intimate contact with their partner because of the dryness. So these symptoms can be taken care of. The other long-term implications are the estrogen hormone protects women from cardiac problems
Okay.
and cerebrovascular problems like stroke.
Okay.
So we see typically the woman gets the ischemic heart disease or angina, that is pain in the chest, or myocardial infarction or paralysis 10 years later.
Okay.
Men get it between the age of typically 45 to 55. Women get it from 55 to 65.
Okay.
The bones also become more fragile after the menses stop. It is called osteoporosis. There is a stage, osteopenia and then osteoporosis. The bone undergoes a constant modeling and remodeling cycle, and it requires calcium and vitamin D. So there is something called osteoblast which forms the bone, and osteoclast which destroys the bone. After menopause, the osteoclast activity increases and the bone resorption, that is the absorption of bone tissue, becomes faster, and what we say, the bone becomes very hollow and brittle. So the woman is prone to fractures fast.
Okay.
In this occur in the vertebral column, they get this hump, which we know Manthara of Ramayana fame had that hump.
Right.
If they have weakness of the main thigh bone, which is a weight-bearing bone, and they slip because of this nowadays porcelain tiles or something, they get the fracture of the neck of the femur, which is connecting the appendicular skeleton to the axial skeleton. Or they fall and they take a support of the hand, the wrist fracture occurs. To prevent all this, one has to counsel. We do certain tests. We do a mammography to see whether the woman is having any lump in the breast. And then if all the tests are normal, we can suggest them a hormone therapy, replacement therapy. If the uterus has been removed, we have to just give only estrogen supplementation. If the uterus is intact, this unopposed estrogen can cause the hyperplasia, which I had mentioned earlier, and malignancy. So we have to support that with progesterone. Very rarely, it also can cause breast cancers. But then, if the woman is having a history of breast cancer, we give a separate hormone for hormone replacement. And if something new occurs, so that is why we advise this woman self-examination of breast. Ideally, every woman above the age of 40 should undergo self-examination of breast and mammography at least once in 5 years after the age of 40. Mammography is a soft tissue X-ray of breast. It denotes a early detection of any breast lump, and sometimes that breast lump can be malignant type. So we take a biopsy, and if it is there, then a cancer breast can be treated much better if it diagnosed very early.
Sure.
So other things in menopause supplementation is basically diet rich in calcium. We give calcium supplements, vitamin D supplements. We give something called alendronate, that is zolandric acid, that is it reduces the activity of osteoclast, which I said, and it helps in bone reforming.
Okay.
But the most important thing in this age group is psychological problems. At this point, the woman who is the main mover, everybody knows the Jawaharlal Nehru statement, if the nation has to be awakened, it is the woman who has to be educated. When she moves, the family moves, the village moves, and the country moves. It was a very famous statement that time. And our Prime Minister Modi has a lot of importance to women education and women empowerment, which is very good. So at this particular time, the woman has given all her life for the family. The children have grown up. They have gone to study. Nowadays, a lot of people are going abroad to study. Husband is still doing his job or what is his business. And then they feel these hormones are depleting and they get something like an emptiness syndrome.
Right.
So then they should have a group. They should have develop a hobby. They should talk with each other. I remember my mother, she's an anesthetist. They have a group of doctors. They meet every month and they share and they have developed new hobbies.
Right.
So that way they keep occupied. Otherwise, depression is very common in this age group. So that also has to be taken care of and we have to speak out.
Right.
That is very important.
Sure. Would you like to give message to our viewers to inculcate healthy practices?
Yeah, so that is a very important question and very important point. I joined Godrej Hospital way back in 2006. Now I'll be entering the 20th year. And there I had the opportunity to give a talk. Earlier, I gave the similar talk at Reliance Hospital and then at Godrej. And then I given it on multiple platforms. It is on Preventive Gynecology and it is a subject which is very close to my heart. Means generally we always teach our children prevention is better than cure. But we hardly follow it.
Right.
At least during the COVID, we are now used to washing our hands, taking those sanitizers, using masks and everything if we have cough. But even in gynecology, prevention is better than cure.
Sure.
So one thing is one has to prevent lot of diseases. Important thing on prevention is vaccination. For all the girls who come to me, or if the mother has come and she has a daughter, I advise them about 2 tests, rubella IgG and a varicella IgG.
Okay.
These are German measles and chickenpox.
Okay.
Why? Because if this IgG is positive, then nothing to worry. If they are negative, then one can give a rubella RVAC vaccine, which is just 50 rupees,
Okay.
or a varicella vaccine, which are 2 doses. Because if this girl is going to be a woman later on, or going to be pregnant, and if in the first 3 months of pregnancy she develops German measles or chickenpox, then we have to sometimes terminate the pregnancy.
Okay.
By these simple vaccines, this problem can be avoided.
Right.
Cervical cancer vaccine is coming in a big way. Cervical cancer, that is the cancer of the mouth or the womb, is diagnosed by screening tests like pap smear
Right.
and confirmed by a cervical biopsy.
Okay.
But this occurs because mostly 95% of these cancers occurs because of a HPV virus called a human papilloma virus.
Okay.
And there are a lot of subtypes of it, of which few are carcinogenic.
Okay.
This virus comes in the woman's womb or the mouth of the womb through a sexual contact
Okay.
from the smegma. The smegma is the part of the secretions below the foreskin of the male organ.
Okay.
And then it goes in the woman's cervix, that is the mouth of the womb.
Okay.
It goes and resides there. And if that strain is carcinogenic, it undergoes changes and that woman can develop a cervical cancer later on.
Okay.
When we give cervical cancer vaccine, nowadays it is it's soon going to be part of the National Immunization Program. And vaccine is been developed by the Serum Institute.
Okay.
Otherwise, it was earlier by GlaxoSmithKline and Merck. The Merck vaccine is the most famous.
Okay.
So it is virus-like particles which causes antibodies against the human papilloma virus. If it is given to the girl and she develops those antibodies, she will never get that HPV infection.
Right.
And she will reduce a risk of one cancer from her life forever.
Right.
So I personally feel that should be a part of the health screening program.
Okay.
Hemoglobin should be checked because the woman only gets menses and they are losing blood.
Right.
So the anemia part has to be corrected. We should always try to keep it at 12, give healthy foods. We should keep a track on the BMI. We should not allow excess weight gain, reduce the junk food.
Right.
Strength training exercises are very important. It helps in menopause and sarcopenia later on in life, that is muscle weakness. All the girls, whenever they can, I have 2 daughters and I taught both of them about the safe practices of local hygiene. They should have good ablution techniques because urinary tract infection is very common in girls. Why? Because both the spaces are very near to each other. If they are working, then they are using a common toilet. Indian toilets were safe. Nowadays, everywhere there is a Western toilet called commode, and if they sit in that, they have more chance of infection from the thighs. Our teacher, Dr. O.P. Kapoor, we used to attend his lectures at Birla Matoshri in our second MBS. He used to demonstrate on table, on the stage. When a woman is cleaning her after a toilet, she has to take her hand from ahead to back. Even if they are using this jet spray, it should be from front to behind. If it is the other way, then some particles may just go up, and the same bacteria causes severe infection. Because in the males, the organs are widely spaced because of the male organ, but a woman, the urethra is only 4 centimeters. Then if they get recurrent infections and the infection heals, then part of the urethra, that is the pipe between the bladder and the outlet, becomes narrow and causes stricture urethra. It causes retention of urine, and that causes more infection. Commonest cause of elderly age woman is prolapse, where some urine retains, and this infections recurrent can cause urine kidney problems. So this is a very simple technique of local hygiene can prevent this major problem. We have to advise them about the anatomy which I explained. I have the privilege of taking lectures to the school-going girls of 8th standard in the Pawar Public School at Bhandup. My teacher had recommended me to go and take lectures, and we have to make them aware of contraception and safe practices, safe sexual practices, preventing of unwanted pregnancy. If a period is missed, they should report to doctor early, because we can avoid a surgery and give medical abortions, medicines for abortions. Then the different contraceptions have to be known to them, so that they unnecessarily don't go for repeated MTPs. Luckily, with all the programs conducted by our parent or body, that is FOXY, Federation of Obstetrics and Gynecologists of India, so we have now reduced the rate of unwanted pregnancies and MTPs. They should know the importance of antenatal care and prenatal counseling. That folic acid tablet which I told you is a very good supplement. They should see doctor early if they have any gynec problem. Do a pap smear, do a mammography. And even if after menopause they have any symptoms, they should get themselves treated. If they get bleeding after menopause, that usually we see patients, they get heavy bleeding during the age of 45-50. They consult their friends and they say everything is okay, period will go. Period goes, and after 5 years they come with another episode of bleeding. And that time already a malignancy has occurred. This could have been prevented if they came early to a doctor. Any bleeding above age of 40 years requires to be investigated. Nowadays we don't do a blind DNC. As I mentioned, a hysteroscopic guided DNC is important. We can see inside the cavity. We can see any suspicious areas. We can take a biopsy. If the cancer, if the report comes in a precancerous state, that means a complex hyperplasia or a typical hyperplasia, we can give them a removal of the uterus by a simple natural orifice vaginal route, which the surgery takes hardly 1 hour, or a laparoscopy surgery. They can recover in 2 days and they can prevent a major cancer in future.
Sure. Thank you so much for the information. With this, let me take this opportunity to thank Dr. Samir for his valuable time today and decoding gynecology and emphasis on prevention rather than cure. Wishing you success in your noble work in the field of medicine towards getting your women patients to lead a healthy life. I came across a beautiful quote: an obstetrician is only medical practitioner before meeting whom your heart beams with exhilaration and your mind is full of hopes, and after meeting whom your mind echoes with the unseen bits and heart remains captivated in ebullience. Stay healthy, happy and blessed. Dhanyavad.